I was thinking of what I could do my report on, and then because I had no idea, and I had a patient last week, or actually one of Gary's patients, he received antibiotics after his surgery, and so I just kind of went from there, and I was researching and found that receiving, and I guess focused on orthopedic surgery just because that's what we have been working on mostly, or working with mostly, and so I found that the use of antibiotics before surgery plays a big role in lowering surgery site infection, and the figures showed that like almost 100% of surgeries they use the antibiotics beforehand, because I was going, I guess, to focus on is if it is beneficial, but I guess it's pretty obvious that it was, or according to my studies. I'm assuming Meritor gives people antibiotics before surgery. But then I was researching more and found, I guess, research about how important the timing is about for receiving antibiotics, and it's very important to get it like at most 60 minutes before they start the surgery, or like the incision. And so I guess I found a lot of studies that it showed how important it was, but on the same hand, not a lot of places follow that. Like on one study, half of all surgeries received the antibiotics within an hour, even though there's so many studies to show that it's so important. And I guess I was just wondering, or that was my question, why don't they follow these guidelines when, you know, as far as other medicine administration, they are so anal about, you know, well, especially Meritor, that 30 minutes before or after. Why can't we follow that before surgery? Just seems kind of silly, considering that this surgical site infection is like a huge contributor to, like, it's one of the main healthcare associated infections, or whatever it's called. I guess it just seems kind of silly why hospitals don't abide by that. And you think with Medicare and Medicaid, how they don't like to cover hardly anything, they would be really strict. You know, they won't even cover an like a UTI that was acquired in the hospital, but yet they'll cover some of this stuff. I don't know, it just seems kind of silly. So that was just my topic that I wanted to bring up, is why don't they, why aren't there more strict guidelines of administering antibiotics before surgery, when everything else is so regulated and very strict and whatnot. So I guess so I didn't really get to answer my question, why they don't, but I don't know, I think that's about it. Okay, shut it off.